So, how is everything going with you today, Mr. Nick Baker?
Everything is fine. How are you?
I'm doing well, thank you. I think we are going to be able to take care of those 2 cavities today.
Am I going to get a shot?
Yes, but it will only be a small pinch and will be the worst part of the procedure. I pride myself on giving a very gentle injection.
Oh gosh, shots make me nervous. Could we maybe just do a cleaning or something?
Well, everything depends on what you are comfortable with. We do really need to take care of those cavities so they don't get worse. Mr. Nick, are you feeling okay?
Yeah, I feel fine. I had a snack before I came, so my blood sugar should be good to go. But a diabetic crisis always worries me, you know.
I can recognize the symptoms. Please let me know if you start feeling worse.
Okay, so is the stuff in the shot going to make my diabetes worse? I am super nervous about everything that is going on. My friend said that these really hurt.
Have you ever experienced dental local anesthetic?
I got a shot as a child that really hurt.
Mr. Baker, I know that you have had bad experiences, but here at Gentle Dental, we never proceed with any procedure if you are uncomfortable or have any questions. Hello, future dentists. Do you know what causes dental fear? Negative previous experiences, not feeling in control, lack of behavioral control, and lack of cognitive control can all contribute to dental fear. Your diabetes should not interfere with the shot as long as your blood sugar is under control and you trust me as your provider. Most patients leave the office feeling great. However, before we begin, do you have any other questions or concerns?
So you've done a lot of these before. Have you had patients with diabetes before? I am just nervous about it hurting or something going wrong.
Sure have. I give many shots every day, and yes, approximately 10% of my patients have diabetes. It has not been an issue in the past.
That makes me feel a bit better, but I am still worried about the pain. Is there anything you can do to make it hurt less?
We use a numbing agent to help with the initial pain. Once the teeth are numb, you will not feel a thing. It's less worth it.
Okay, I guess we can give this a shot. No pun intended.
Sure. Is there anything else before we begin?
Well, one thing I should probably tell you is that I started smoking last year. I was too embarrassed to write it because I didn't want to be lectured. How would I deal with the situation of dental fear?
Be empathetic, trustworthy, and a good listener. Make sure to encourage communication, demonstrate competence, and provide information. Okay, I am glad you told me. Is there any reason you started?
Last year my dog ate my pet rat, Jimmy, and smoking helped me get away and relax.
I am so sorry to hear that. Since her passing, have you tried to quit?
No, not really. I still get really sad sometimes thinking about it. I'd actually love a cigarette right now.
It is hard to give up comforting habits. Have you noticed any health or dental issues since you started?
I feel like my teeth are getting more yellow, and I am guessing my breath is a bit rank. But it's not something that I always notice.
On a scale of 1 to 10, how much do these issues bother you? 10 being that it bothers you a lot, and 0 being it doesn't bother you at all.
I would say about 4.
And why not a 3?
I'd like to have white teeth and tasty breath so that I can hopefully get wifed up headache.
What do you think about letting me help you quit? I'll even throw in complimentary whitening if you quit for good.
I am not proud of it, so I guess it ain't a bad idea to try to stop. How can you help me?
Together we can go over some strategies to stop, and I have a few people in mind you can speak to about quitting for good. So, what are my key motivational interviewing techniques, you ask? What are my techniques? I create a supportive atmosphere and build trust with the patient.
Dodge the shot again. Score.